Order. Dan Carden to move the motion.
Thank you, Ms Butler. I appreciate your chairing of this debate. And I'm also grateful for having secured the time today to talk about an issue that has touched thousands of people and left a lasting trauma, I think, across our country. Can I start by giving thanks to the extraordinary campaigners, from Rights for Residents, John's Campaign, Care Rights UK and others, some of whom are with us today in the public gallery. And can I mention Diane, Jenny and Julia in particular, who have supported me throughout my work on this issue. Their tireless advocacy, often fueled by personal grief, has sustained a powerful call for change. I'd also like to thank everyone who's contacted me ahead of today's debate to share their stories. I can't name them all, but that together they form a mosaic of heartbreak and of courage. Their voices are the reason we're here today, and I will do my best to honour them. There are moments in our national life that leave deep scars. One of the most painful of these, still raw for so many, was the enforced separation of families during the COVID-19 pandemic. In care settings across the country, people were cut off from those they love for hours, days, weeks, months, for some until the very end. Families are still living with the trauma of that separation.
Would my other friend give way?
I will.
Thank you for giving way. One of my constituents, Tracy, came to speak with me in one of my advice surgeries. Her mum, Doreen, was one of those individuals you're talking about so well here in terms of being in a care home during the COVID pandemic and being cut off from a lot of contact. Now, she really suffered as a result of this. Now, would you agree, would the honourable member agree, that it's really important these stories are heard as next steps are considered on this issue?
Thank you, and I'm sure your constituents, as I am, will be really grateful that you have come here today to add your voice to this campaign. As I said, families are still living with the trauma of that separation. And yet even now, as I'll come on to later, people in care settings are still being denied essential human contact. We all understood in those early days the need for swift and serious measures to protect public health. But not enough was done to balance the need against the harm of isolation on mental health and well-being. Somewhere along the way, something vital was lost. The right to connection, the right to love, the right not to die alone. Let's remember what that meant in real human terms. Elderly people confined to their rooms in care homes, with no familiar face and no hand to hold. Sick and disabled people denied a trusted advocate when they needed them most. Val wrote to me ahead of this debate. She told me how she was forced to watch her mother's health decline through the pane of a glass window. Her mother lost weight. She lost the ability to walk, to feed herself. In time, she became deeply depressed and withdrawn. And yet, when visits were allowed once again, Val saw a transformation. With regular contact, with care and love from a family member, her mother began to return to herself. And Val told me it wasn't the dementia or COVID that got her. It was loneliness, isolation and abandonment. Gemma also shared her story. She described how her mother was kept in solitary confinement-like conditions. When Gemma's mum's partner died, suddenly, she had to break the news over a stuttering video call with no family there to comfort her mother as the grief landed. These stories represent a pattern of suffering that should never have been allowed and must never be repeated.
Thank my honourable friend for giving way, and I'd just like to briefly mention the case of the Priestman family in my constituency. Paul Priestman, a military veteran, suffered from a stroke in 2019 and now requires care. However, this is being provided in a care home in Rochdale, many miles from their family home, and the family have serious concerns about the quality of Paul's care, but find they are routinely ignored by the care home in question. Doesn't the stories that he advocates and this whole debate show that too often rather than families being viewed as essential to the well-being of the person in care, they are often dismissed, ignored or thought of as an afterthought by care providers.
I'm grateful to my honourable friend, and he grasps the seriousness of this issue totally, and it's why campaigners are campaigning and fighting for a legal right to maintain contact Gloria's law. It would put into law the right to at least one care supporter, a trusted loved one, to provide support and advocacy in all health and care settings, so no one is ever alone when they need help the most. The campaign is supported by cross-party MPs, over 100 organisations, including COVID-bereaved groups from all 4 UK nations, charities, disabled rights groups and bodies such as the National Care Forum. In response to this pressure, the previous government amended Care Quality Commission regulations to make facilitating visits part of the fundamental standard of care. And I would like to pay tribute to the member for Faversham and Mid-Kent who steered that through government in the last Parliament. The newly inserted Regulation 9A requires that in-person visiting in care homes, hospitals and hospices and accompaniment to appointments always be facilitated by providers in line with people's needs and preferences. Only in exceptional circumstances should this be restricted. While this is a welcome step forward, it has fallen short. Just like the guidance that preceded it, Regulation 9A lacks clarity, oversight and accountability, and in practice it is too often misunderstood, misapplied or outright ignored. This past winter, Rights for Residents received hundreds of calls from distressed families who were blocked from seeing their loved ones. Outbreaks of flu or norovirus were being used as justification to deny all access. In some cases, for over 2 weeks, despite Regulation 9A being in place. To give just a couple of examples, Tina's mother, who has dementia, was in hospital being treated for pneumonia when a blanket visiting ban was imposed due to an outbreak of norovirus. It took days of trying before Tina received any update on her mother's welfare. Days later, she received a voicemail, her mum's frail voice whispering, "Don't give up on me, Tina." Her mental and physical condition deteriorated rapidly during this time, which Tina believes was exacerbated by their separation. Amanda's mother, who lost mobility after a brain hemorrhage, depends on family support for personal care and emotional well-being. But during another blanket ban, Amanda, despite quoting Regulation 9A, was told that her mother's right to contact was not worth the risk. By the time visits resumed, her mother had lost weight and become visibly withdrawn. Many similar experiences have been reported to Care Rights UK's advice line from people denied access to their friends and family, including when the care provider was aware of Regulation 9A but still chose not to comply with it. For example, they recently supported someone living with dementia who had had their visits stopped as part of a settling-in process in their care home. The provider failed to recognise the importance of maintaining support from familiar loved ones as a key part of dementia care. To understand the scale of the problem, Rights for Residents ran a national survey between February and May this year. The results are deeply concerning. 4 in 10 respondents had never even heard of Regulation 9A. 1 in 4 reported care settings implementing complete visiting bans since April 2024. Even when family members were aware of and cited Regulation 9A, in over a third of cases this had no effect on visiting arrangements. And many care settings continue to regard Regulation 9A as guidance only, which can be ignored without consequence. As Rights for Residents put it, these findings indicate that the introduction of CQC Regulation 9A has not been effective or sufficient in upholding the visiting rights of those using health and care settings, and that as a result, people are experiencing avoidable harm from unnecessary visiting bans. The conclusion is clear. Without a clearly defined legal right to maintain contact, access will continue to be patchy, precarious, and far too easy to deny. The postcode lottery of uneven implementation was unacceptable during the pandemic, and it's unacceptable now. And I want to stress that this is not about unlimited access. Care supporters would be subject to the same appropriate safety precautions as staff. It's about protecting the principle that the connection with loved ones is not an optional extra. It's essential to dignified care. No member of staff, no matter how professional or compassionate, can replace the bond between a parent and a child, a husband and a wife, a brother and a sister, or a lifelong friend and partner. And loved ones are more than companions. They are vital safeguards. They are the eyes and ears that notice what others might miss. They protect against neglect, spot subtle signs of distress, and speak up when something isn't right. To leave this matter to the discretion of individual managers without clear legal underpinning is to leave the most vulnerable at the mercy of arbitrary decisions, which could severely impact their well-being. It's not only a matter of compassion, it's a matter of rights. We all have a right to a family life. That right should not disappear behind locked doors when someone requires care. That's why we're calling on the government to guarantee the right of every person in a care setting to have at least one essential care supporter. Not just guidance, not tinkering around the edges of regulation, but a right protected in law. During the last general election, my party, the Labour Party, promised to make this change in government. That promise must now be delivered. It said, we will guarantee the rights of those in residential care to be able to see their families. Well, the only way to guarantee this right is through the law. The review of Regulation 9A is due shortly, and from the 30th of June to the 31st of July, the COVID inquiry will hear evidence on experiences of the care sector during the pandemic. As families relive the trauma of that period, the government has the opportunity to show them that they have been heard, that lessons have been learned, and that action will follow. If we truly believe in dignity, in compassion, in care, then this cannot be delayed any further. We owe it to every family torn apart. We owe it to every patient or resident still facing the risk of being isolated. And we owe it to every one of our constituents who fears that, when the time comes, they too might be left without a loved one's hand to hold. This change will cost the government nothing, but for those it protects, it means everything. Thank you.
The question